Emma had just moved from another school district to a high school that contained around 2,000 students. Being new to the school and joining it in the middle of the year, she found it hard to make friends. Emma spent most of her lunches just sitting on a bench and listening to music. She tried to join school clubs, but found she did not fit in. Emma gradually became depressed. Her school had only one psychologist and 3 therapists. Emma waited 2 weeks for a meeting with the overworked psychologist, only for her to look at her grades and dismiss her off, saying she was doing well academically and that if she continued attending the school clubs, she would eventually feel better. Over the course of the next few months, Emma stopped wanting to go to school anymore. She came up with one excuse after another in hopes of being able to stay home. One evening, Emma took some pills not meant for her in order to avoid school the next day. Her cries for help had been neglected. Emma passed away later in the ICU. Then there was Priya. Priya was a close family friend in elementary school. I remember once while we were on a camping trip, our parents left the 2 of us and went hiking. Priya and I sat by a river and talked about life, and suddenly the conversation got pretty deep. Priya told me about how much she was suffering. Priya struggled with OCD and was constantly under high stress. She felt her life had been hijacked by the illness. Priya was always checking things, performing repetitive rituals, and organizing things. In the past year, Priya had become a germaphobe and washed her hands up to 20 times a day. The skin on her palms was peeling all over. She was haunted by her intrusive thoughts and didn't know what to do or how to live with this disorder. After she was done talking, I was speechless. I didn't know how someone who looked so happy on the outside was stressed, overwhelmed, and didn't know how to go on. Even though Priya moved away a few years ago, her story and Emma's still stick with me to this day. Ever since then, I've constantly been thinking about the topic of mental health and how it affects people. Recently, through my research, I found that there's actually a countrywide shortage in the number of mental health care providers. In the US, a developed country, approximately 158 million people live in areas that are federally said to have a shortage in mental health care providers. In these areas, only 30% of people's mental health needs are being met. Psychologists are overextended with the amount of patients they have, and in a few years, the US will lack approximately 14,000 to 31,000 psychiatrists. Youth are more willing to talk about their mental health these days, but there's a wait list for therapists, and patients have to wait months until they see a psychiatrist. There are many causes for this shortage. For example, population growth and the increase in mental health problems due to the COVID-19 pandemic. But also, many mental health care professionals are reaching retirement age or are resigning from their jobs. This resignation is due to insufficient pay, as they get paid 15% less than primary healthcare providers. This resignation is also due to burnout. Mental health care providers are burnt out from the excess of patients they have and paperwork. Regarding this patient overload, they could get even more burnt out from sicker patients that haven't received help in a long time. These workers don't get enough emotional support from their colleagues or managers and are expected to just continue working even when they might be affected by their patients' suffering or trauma. Another cause for this shortage is the lack of residency slots for training people who want to become mental health care professionals. County, nonprofit, commercial mental health care departments are finding it hard to hire more workers because of this. Insurance can also be an issue, since not all hospitals will accept the patient's insurance company, making this problem even more complex. So yes, technically the Bay Area is on the better side in terms of the number of healthcare providers, but it's hard to tell which ones actually accept insurance or cash. The extremity of this shortage for patients can also depend on the type of care they need or the type of provider they want, whether it's bilingual, female, or more, or another type of provider. The use of telemedicine has helped solve this problem to some extent. Telemedicine is basically where patients are remotely treated, usually through a software like Zoom. This treatment consists of medicine being sent to the patient's nearest pharmacy and also a diagnosis of their disorder. A collaborative care model has been developed as well. In this model, patients meet with their primary care provider in something like an annual checkup. And then that patient is sent over to a psychiatrist who monitors them. And this allows psychiatrists to work with more than one patient at a time. For this mental health care provider access dilemma, there are other solutions too, like increasing the wage, providing more emotional support to these workers, and reducing the paperwork. Also, more high schoolers can be recruited to join the behavioral health workforce. University slots for social workers can be expanded, and students studying to become mental health care professionals should get financial support with repaying their loans. One potential solution that stuck out to me was the creation of a new workforce of peer providers. These peer providers can be any educated person in your community. These peer providers, based on their own experience with mental health problems and with some coaching from professionals, help treat other patients that are suffering with their mental health. In the future, if they want, they can receive an advanced degree if they decide to jump up that career ladder. Now, you may be thinking, why am I telling you all this information? There's nothing that you can do about this, right? Well, that's completely not true. Some things that you and I can do to help solve this issue is we can encourage our peers to think about joining the mental health care workforce. Maybe you can consider joining it. You can consider it as a career option. After all, there is a shortage in these workers. Also, you and I, we can write to the people in public office, urging for a higher pay for these workers, the creation of more residency slots, and financial support for students studying to become mental health care professionals. Even if there is a shortage in these workers, we, as a community, must also address the underlying issue contributing to this problem, the mental health crisis. According to U.S. General Surgeon Dr. Vivek Murthy, loneliness increases a person's risk of developing mental health challenges. Each of us can start now in our own lives by strengthening our connections and relationships. We can be there for one another, creating a support system. We can answer that phone call from a friend. We can work on making time to share a meal with one another, listening to each other without the distraction of our phones. We can perform an act of kindness. Human connection is easy, but remarkably powerful. Loneliness is a threat to our mental health, but we have the power to change that. So yes, there is a shortage in these mental health care providers, but we can do our own parts to help. So let us all work together to solve this mental health crisis. Thank you.